Okay, measure hip flexion, patient position supine. Our axis is at the greater trochanter. The stationary arm is lined up parallel to the midline of the trunk, and our movable arm is in line with the long axis of the femur. It's a passive measurement.
Normal range of motion.
Normal range of motion is from 0 to about 110 to 125 degrees of hip flexion. Okay, to measure hip extension, again, supine position, have them slide off the edge of the table. Axis is at the greater trochanter. Stationary arm still parallel with the midline of the trunk, and the movable arm still along the long axis of the femur. You have to stabilize the pelvis, and then you're going to passively hyperextend the hip to end range, keeping the knee in extension, and your normal range is going to be from 0 to 15 degrees of hip extension. Contact. Alright, for hip abduction, abduction, patient again supine, your axis is at the ASIS on the affected side. Your stationary arm is the line connecting the left and right ASIS. Your movable arm will be parallel with the long axis of the femur. You're going to read it from neutral with the goniometer reading 90 degrees is your neutral position. You're going to passively abduct them to that hips at the limit of motion, and your normal range is from 0 to 45 or 50 degrees. Alright, to measure hip adduction, again, supine position, axis is the same as abduction, ASIS. Stationary arm is the line connecting the left and right ASIS. Your movable arm is parallel with the long axis of the femur. Again, you start from neutral, so the goniometer reading 90 degrees. That's your starting point. You adduct the hip across the leg to the limit of motion, and your normal range is from 0 to 20 to 30 degrees. Alright, to measure medial and lateral rotation of the femur, have them in a seated position, a short sit position. Your axis of rotation is at the mid patella. Your stationary arm is going to be perpendicular to the floor. Your movable arm is along the long axis of the tibia. With that pelvis stationary, you're going to rotate the hip to the limit of motion by moving that lower leg and foot laterally for femoral internal rotation. And then medially for external rotation of the hip. Normal ranges are 0 to 35 degrees for that lateral rotation, 0 to 45 degrees for the medial rotation.